Welcome to the Optimum Academy, Heart 101, video number 3, Arterial and Venous Disease. I'm Venous Joannides, Chief Medical Director at Optimum Reinsurance. So let's get started. In the body, we have the arteries designated in red here on the picture, and the veins in blue. So the arteries come from the heart, distribute blood to all the cells in the body through the arterial system, providing oxygen and nutrients, and the blood returns to the heart to get reoxygenated in the lungs via the blue vessels, the veins. So let's talk about some particular arterial diseases that occur that we see in applicants applying for life insurance. So not uncommonly, we see people who have had a transient ischemic attack, also called a TIA, or there may be a question that they actually had a stroke or a cerebrovascular accident, a CVA. So if people have certain symptoms that last less than 24 hours that may be associated with neurologic disease, that may be attributed to a TIA or a transient ischemic attack. So it seems like it's more temporary and passes, and when a brain scan is done, there's no lingering damage to the brain. However, in a stroke or CVA, cerebrovascular accident, there is long-lasting damage to the brain that shows up on a brain scan, and there's usually persistent signs and symptoms associated with that. And you can see in the pictures provided on the slide, in a TIA, there's probably smaller little clots that block vessels temporarily or partially, whereas in an ischemic stroke, a clot actually blocks blood flow to the critical arteries in the brain and causes the neurologic damage. So these are due to disease in the carotid artery usually, and the problem is carotid artery stenosis. So carotid arteries on both sides of the head and neck feed blood to the brain. If those arteries become clogged with plaque, carotid artery stenosis is present. This impeding of the flow of blood to the brain is dangerous because the brain needs to be supplied with blood continuously in order to function properly. So surgery may be necessary to clear the blockage in a carotid artery, take out the plaque, the offending plaque that's blocking the blood flow, or sometimes a stent may be put into a carotid artery, as demonstrated on the slide on the right at the bottom, to make sure that there's a pathway for the blood to continue flowing to the brain to provide the nutrients that the brain requires. Peripheral vascular disease, PAD, or peripheral artery disease, abbreviated PAD, or peripheral vascular disease, PVD, usually refers to arterial disease outside of the main part of the aorta. It's usually blockage in an artery due to plaque. It's high risk if the person also smokes tobacco. So if you see an applicant who has peripheral vascular disease and continues to smoke, that's extremely worrisome. And sometimes PVD is also used to describe venous disease, which happens with deep venous thrombosis. So you have to make sure what the person that put the initials PVD is actually referring to. Are they referring to arterial, peripheral disease, or are they referring to venous disease? Arterial disease is usually much more worrisome, although venous disease in the legs can be a source for deep venous thrombosis, which can be associated with pulmonary emboli. And you can see in the pictures designated on the right the difference between blood flow in a normal artery to the left, which has a clear lumen, dark red, versus peripheral artery disease on the right, which has blockage and stenosis in the arteries, which clogs the blood flow to the return of the blood to the necessary tissues. Coronary artery disease is an arterial disease, also abbreviated CAD, and this is a very worrisome arterial disease. It's a condition that occurs when the coronary arteries have difficulty supplying blood, oxygen, and nutrients to the heart muscle. And since the heart is the main pump in the body that's required to pump the blood around the system, any deficiency in the activity of the heart muscle certainly could be a major problem. So symptoms related to people that have coronary artery disease include chest pain on exertion, which is also called angina, which is relieved by rest. So if somebody is walking, begins to have chest pain, and they sit down and rest and the pain goes away, that's typical of angina. It could also be associated with shortness of breath or pain radiating up to the arms or shoulders or even the jaw. So you can see in the picture included here, the arteries of the heart are on the outside of the heart. A healthy artery has a clean lumen up at the top, and you can see how stenosis in some of the other depictions of the artery, the yellow material, clogs the artery and therefore impedes the blood flow to the cardiac muscle tissue, and that's what causes the problem. So we do tests in coronary artery disease to see if there's a narrowing of one of these arteries, and you may see in attending physician statements a test like coronary catheterization, where dye is actually injected into the coronary arteries to see if there's any stenosis or blockage. Also, coronary CT or coronary MRI angiogram can be done. Often people at risk have a coronary artery calcium score, because calcium that's detected in the arteries can be associated with coronary artery disease. So that's a proxy for CAD. Also, other tests are perfusion or SPECT scans of the heart on exercise, and also a stress echocardiogram, so an echocardiogram of the heart, which is done during an exercise test, or just the typical treadmill stress test, where somebody is put on a treadmill and exercised, and their EKG is monitored for any changes that might be typical of ischemic changes. Obviously, with coronary artery disease, hopefully the thing you can prevent is a heart attack, or also called myocardial infarction. So those myocardial cells actually die. There's death of heart muscle due to critical lack of blood flow, oxygen, and nutrients. So immediate treatment is needed to prevent more myocardial cell death, because that can lead to dangerous arrhythmias, poor cardiac function, and death. So emergency treatment is necessary when somebody has coronary artery disease that causes a myocardial infarction. So, what are treatments for coronary artery disease? The most worrisome arterial disease, that would be emergency treatments of injecting thrombolytic drugs to clear the artery. In other words, drugs are injected to actually break up the plug that's causing the slow blood flow in any of the coronary arteries. Also, an emergency coronary angioplasty, where a tube is inserted into the coronary artery to inflate and blow up the size of the stenosis of the coronary artery, and possibly a stent is left behind to make sure that blood flow is adequate to the myocardial tissue. Or in some cases, major surgery is required with open chest surgery, and coronary artery bypass grafts are placed to help with blood flow around any blocked area in a coronary artery. Additionally, lifestyle and drug treatments are necessary, so lowering cholesterol levels with medications as statins, cessation of tobacco smoking since that causes major problems to arterial disease, gaining ideal body weight, so losing excess pounds may also be useful, and then a graduated exercise regimen to get the person back into physical shape under the guidance of a physician is also usually recommended. So just to let you know what a coronary angioplasty with a stent entails. So as I said, a tube is put into the coronary artery to blow it up and hopefully expand the inner lumen of the blood vessel, the coronary artery. As the balloon inflates, a stent can also be expanded and then left in place to make sure that there is no re-stenosis of the coronary artery. And there's also some stents that actually have drugs within the stent. So it's called a drug-eluting stent, and it provides medication to help keep that particular coronary artery open. In terms of venous disease, what do we worry about? Particularly common that we see in people applying for life insurance are deep venous thrombosis, and abbreviated DVT, and pulmonary embolism, which may be PE. PE is also used to describe just physical exam, but if you see PE abbreviated with DVT or other problems related to sudden shortness of breath, it may be related to pulmonary embolism. So a DVT in the legs, in the deep veins of the legs, the large veins of the legs, can be due to sluggish blood flow, like when someone's on a long plane trip to Europe or back from Asia, or a clotting problem like factor V Leiden. Those can precipitate blood clots in the veins, thrombosis, which in some instances can break free and go to the right heart, to the lungs, and cause pulmonary embolism. So on the left at the bottom is a picture, and let's go through this diagram to show how this all takes place. So if you see the red circle at the bottom, this shows that the red lines show blood coming to the legs, and then the blue is returned to the right heart. So see the red circle, it's circling pelvis and legs. So let's say a thrombosis forms in a large vein like in the red circle. It goes to the left and then up the blue channel to the blue part of the heart, or the right heart, which then pumps that blood to the lungs. So if there's a clot that breaks loose, it goes right to the right heart and is pumped to the right heart and then to the main pulmonary arteries, designated also in blue, but I've circled in green the right and left pulmonary artery. Those go to the right and left lung, and that's where the pulmonary embolism problem occurs. So the clot that was in the legs has gone all the way through the right heart in blue, and in the blue pulmonary arteries to the lungs, causing an obstruction and then a pulmonary embolism in the lungs. So that's why it can be very dangerous and can cause sudden death if the situation is severe enough. So that completes arteries and veins. Please continue with our series of Heart 101 for additional information on the heart.